Well, delighted to say we're joined this morning by esteemed ophthalmologist, consultant ophthalmologist based in London, Mr. Sameer Trikha. And I'm delighted to say we're going to talk all about laser eye surgery and some of the ways technology is improving ophthalmology as a whole and the technological advancements. So, Mr. Trikha, thank you so much for coming on board this morning to talk about it.
Oh, it's my pleasure. It's great to be here.
Brilliant stuff, Mr. Trigger. Maybe before we go into the questions, if you want to maybe give patients or viewers maybe background information about yourself.
Yes, absolutely. So my name's Sameer Trikha. I'm a consultant ophthalmic surgeon. Uh, as you heard, I'm based in London, and my practice is based in the Harley Street district. I am a comprehensive ophthalmologist, but my focus areas are in glaucoma and cataract surgery as well. So all forms of cataract surgery for patients with refractive issues. A little background about myself. I have a faculty position at King's College Hospital in London, and prior to that, trained both in the UK as well as undertaking two subspecialty fellowships in glaucoma at the Singapore Eye Research Institute and Singapore National Eye Centre, uh, which was for about a year and a half or so. And then I went on to Moorfields Eye Hospital in London to conduct a second fellowship in glaucoma. I also have a strong interest in technology and entrepreneurship within ophthalmic care. I completed an MBA from Imperial College London, and also founded a company in artificial intelligence in ophthalmology, which now produces solutions for eye screening.
Fantastic, Mr. Brica. Definitely founding that company there. The technological company will be a great, I suppose, catalyst for our conversation today. And we're going to really focus on technological advancements in ophthalmology. So it's fantastic that you have such a broad range of experience in that field for sure. Absolutely brilliant.
Thank you. Yes, no, I think ophthalmology is a great subspecialty in the sense of medicine, in the sense that, we are constantly trying to push boundaries in the way we can improve outcomes for our patients. As we know, eye-related conditions are very common around the world. As we look at sort of wider demographic trends, we know that populations are getting bigger and also patients are living longer. And as a consequence of that, there's a higher chance of patients developing eye-related problems, typically like cataracts or conditions like glaucoma, or indeed age-related macular degeneration is also very common as we get older in life. And therefore, the need for eye care is going to increase as time goes on.
Absolutely, Mr. Trigger. It's very reassuring to hear that it's a real a real a real something that you're really focused on for the future for patients, something that's going to be a priority for ophthalmologists worldwide, which is fantastic. And I suppose, can you detail some of the latest advancements in laser eye surgery?
Yes, of course, there are many advancements actually in laser eye surgery. If I could maybe group those first to different particular conditions. Of course, when we think about laser eye surgery, the most common thing we think about is laser eye correction, such that we don't need glasses. And increasingly, there are more techniques now that are available to allow us to deal with different types of what we call refractive error, such as short-sightedness, long-sightedness, or astigmatism, of course. Um, Nowadays, very commonly, patients undergo a procedure called LASIK, where the front surface of the eye, the cornea, is reshaped to provide optimal vision for patients' eyes. But in recent times, that technique has been adjusted slightly to a new technique called SMILE, where an even smaller little tiny cut is made into the eye, and a similar process is followed. But that results in a much faster recovery for patients and much quicker visual rehabilitation as compared to previous iterations of laser eye surgery. And another form of surgery that's gaining a lot of popularity is typically designed for patients who are getting beyond the age of 40. Now, as we get a little bit older, we lose our ability to focus on near things, and that often requires us to have reading glasses or spectacles for near work, such as the computer or using a phone or reading a book, for example. Now, in many cases, that can be quite difficult for patients who live a very active lifestyle. And a laser option called presbyond laser also exists now, which is able to allow patients to actually have laser conducted on both eyes, but that the dominant eye is set for distance, giving them very clear vision for the distance, but the non-dominant eye is set for near sight, so a sight blended vision, so that with both eyes together, patients are able to see independently for most tasks without the need for glasses. And this is what we call micro monovision as such. So that is also a very exciting area of laser treatment for patients looking to improve their eyesight and no longer require glasses. Another really exciting area of laser surgery in ophthalmology in eyes is in glaucoma care. So glaucoma is a condition typically characterized by high eye pressure, and that can cause damage to the nerve at the back of the eye. Think of the nerve as being a cable that takes light from your eye all the way to your brain, and your brain then converts that electrical signal into a perceived image that you can see. In the case of laser treatment, we now have different forms of laser. The traditional form is called selective laser trabeculoplasty, or SLT for short, which was performed in a laser room as an outpatient, which takes only 5 to 10 minutes or so, but allows us to apply laser treatment to an area within the eye that could then result in a reduction in eye pressure. And in about 70 to 80% of patients, they no longer need eye drops to reduce the pressure in their eye. So it's a fantastic treatment that we now offer as a first line for patients with early glaucoma, or a similar condition that we call ocular hypertension, where people have high eye pressure but don't necessarily have signs of glaucoma at this stage. Moving on from SLT, the latest devices now are what we call non-contact SLT, which allows us to apply the laser treatment without having to put a contact lens on the eye, or requiring much more expensive equipment in a laser room. This can now be applied in an outpatient setting. It's far quicker and showing very good safety as well. So SLT really is coming to the forefront now in glaucoma care as a first-line treatment for patients with early condition of glaucoma or ocular hypertension. So a really exciting time.
Absolutely, Mr. Trikha. Fantastic. Very reassuring for patients. And I suppose you touched on the technological advancements and mentioned that people will no longer require glasses as much. Are you seeing these days less and less patients wearing glasses?
I would say it's an interesting trend. On one side, I am seeing older patients less needing glasses less and less. That's a combination of more patients undergoing laser treatment, but also more patients having more options when they undergo cataract surgery. So cataracts, as we know, are where the natural lens within the eye starts to get cloudy, and that in turn blurs the vision. Other symptoms can include glare or difficulty with car headlights at nighttime, for example. But now we remove the cataract, we can have a multitude of different lens options that can give us vision, good vision across different ranges. And that allows us to be able to be spectacle independent across a number of tasks. So in addition to the laser, we now have lots of different intraocular lens options for patients with cataract surgery. On the other side, however, Connor, I would say that I'm seeing patients, younger patients, more of an increase in terms of need for glasses. And that's really as a consequence of increased near work, particularly in their school age years. And as we know through the pandemic, with lockdowns, a large number of younger people were having to look at screens for long periods of time at home whilst they studied and learned for their classes. And that's had a reflection now that we're seeing an increase in the number of patients who are short-sighted and therefore requiring glasses at a younger age.
Oh, very interesting there about the pandemic, Mr. Trikha. I suppose screens and well, technology in terms of our mobile phones and computers can have a negative impact on our eyesight, for sure. Very interesting trend. And do you think that in the future, our eyes will become more accustomed to this technological advanced change in society?
Well, I think that it'll take us some time to catch up. Of course, in a way, evolution takes many hundreds and hundreds of years, of course. But if you think back that our eyes were designed to see very well for the distance, and of course we had focusing power, eyes were able to focus on near work. It will take a long time for us to adapt to the society around us, but generally computer screens and phones and tablets, of course, are are part of our daily lives now. What I would recommend, just as a segue to our conversation, is for patients to really manage and control the amount of screen time that they have. I know it's easier said than done, but giving themselves 10 minutes break every hour, making sure they give themselves regular breaks during the day to get away from their screens, looking out into the distance, and looking at sort of nature also helps soothe and relax the eyes. Because we are also seeing, aside from the prescription problems that patients are having, we're seeing a lot of dry eye and other computer related irritation in the eyes, just again by excessive screen time use.
Okay, fantastic. And Mr. Trikha, so I suppose, like you say, it will take us time, but it is very encouraged to take regular breaks for the eyes for sure. Absolutely. Well, it leads us nicely on then to our next question, Mr. Trikha. In what ways is technology improving the overall field of ophthalmology? You mentioned a lot of new techniques there. Is it easier also for the surgeon, like yourself, the ophthalmologists who are treating the eye?
Yeah, so a number of technologies are coming to the fore. We are now in a position that we are building robotic systems for ophthalmology. So robotic companies are springing up both across Europe, Asia, and the United States to build solutions that can offer a level of precision in the eye that is actually superior to that of a human. A trained human set of hands is very, very good, very precise at implanting a device within the eye if needed, or taking a cataract out if required. But that said, with high volumes of cases, there is always a very, very small risk of a complication that could arise. Robotic surgery offer a level of precision that in some ways is superhuman. And that is important when you think about the new technologies that are coming in conditions like age-related macular degeneration, or, for example, indeed in cataract, where we are looking to insert for age-related macular degeneration or retinal conditions, insert stem cells in a very specific area, or insert what we call patch grafts of tissue, for example, within the eye. And that requires obviously a level of precision that is very, very, very high. Now, the thing about robots, of course, is they don't have the limitations that a human hand has. A human hand can only work in a certain number of degrees and a certain a level of what we call flexion, where you can bend or adjust your fingers and hands only to a certain amount. Robots have multiple what they call degrees of freedom, and so are able to work in ways, of course, that humans cannot, and do things in a very, very precise and a very repeatable way. So robotic companies are now building systems for cataract surgery and retinal surgery that are performing at a level of precision that's greater than that of humans. The issue at the moment is around cost, because with a human and with the equipment around that, there is still a level of efficiency that humans can generate. So the advent of these robotic systems would have to come alongside readjusting how we go about performing high volume cataract surgery for, of course, the demand that is there. So robotic surgery is definitely coming. And coupled with that, we have what we call intraoperative, or within the operation, we have imaging systems that are able to image the eye whilst surgery is being performed. And that, again, adds another layer of protection and precision for patients to have perfect surgery every time. We're a little way away from it at the moment. These technologies are still in the trial stages, but they will be coming. And I would envisage within the next 5 to 10 years, these technologies will be available for some surgeons and for some patients.
Fantastic, very exciting. The future that lies ahead for sure, Mr. Trikha. And then the ideal patients then. Is there anybody that mightn't be suitable for robotic eye surgery or the new technological advancements? In terms of who really is the ideal patient?
Yeah, it's a good question. I think that most patients I anticipate will be suitable for cataract surgery, or, for example, performed by robotic assisted surgery. What I would say though is that there is an element of stability that we need with the eye. The lasers and the robots will only work once the eye is very, very stable and they are able to manage that. So if a patient, for example, who might have other neurological conditions like Parkinson's disease, may have quite a lot of tremor, for example, they may not be good candidates for robotic assisted surgery at this point in time. But of course, robots will always be able to learn and adapt, and they would never go ahead and start operating unless all the parameters and the eye is very, very still.
Fantastic. And it leads, well, our next question then, Mr. Trikha. Many people wear glasses or contact lenses these days. Will this be as common, do you think, in the near future or in years to come? You mentioned glasses, the increase in young people, but what about contact lenses?
Yeah, so contact lenses, they do have a place. Of course, there are some patients who may, for whatever reason, may not be suitable for laser eye surgery or may not want to go ahead and have laser eye surgery. But I think that overall, traditional contact lenses over the next 10 to 20 years will decrease because, interestingly, there are a lot of advances in contact lens technologies to develop what we call smart contact lenses, which will be able to focus where you focus. So, for example, if you're just wearing a contact lens for the distance, as I said earlier, when you get above the age of 40 or so, you start to lose your ability for near work, and therefore you might need a type or a blended contact lens. But then again, those powers, the strength of those contact lenses are fixed. Whereas the latest technology research is coming and showing that we'll be able to have smart contact lenses that can adjust the prescription as we actually look in different positions of gaze. So that's going to be very, very exciting. The other thing I would just say, to add a little technological slant to it, is actually we will have what we call augmented reality contact lenses, which are able to superimpose an image onto the contact lens that you will be able to see. It'll just be projected about 6 meters ahead of you or a couple of meters ahead of you, similar to how you would be looking at a computer screen. But there won't be a physical computer screen there. It'll just be what we call, information. It might be even linked to the World Wide Web. So you might have, pulling up your email, for example, through a contact lens, or you might be able to look up the weather again through your contact lens, and walk around and look at what the latest train times are as you walk to the station, for example. Those are all things that will be coming with contact lens technology. So I think contact lenses will still have a role, but as I mentioned, there are a number of different options available for patients, even now, to get rid of the need for glasses or contact lenses.
Absolutely, Mr. Trikha. Very exciting, fascinating to imagine potentially patients wearing contact lenses that are almost like a mobile phone. They can really act in an incredible way, really. So that's very, very exciting. Fantastic. And our next question then, what are some of the most effective laser surgery treatments in ophthalmology today then?
Well, I would say that LASIK traditionally, and now more recently SMILE, are very effective. They've proved to become very, very safe in terms of correcting patients' prescriptions, refractive error. And on the glaucoma side, I think SLT has become a mainstay in the treatment for early glaucoma for patients around the world. And it's something that I offer very regularly for my patients. I think it's a very, very safe procedure. And it's also proven very recently, at least for the last 5 to 7 years, following the laser, that the vast number of patients don't need eye drops, and therefore meaning that saves them a considerable burden of having to put eye drops in every day. So I think that those are the two major in most safe laser technologies and most successful.
Fantastic. And how do you see, you touched on it briefly, Mr. Trikha, how do you see the future of eye surgery in general? Do you see any significant changes in terms of how robotic assisted surgery will come into play, or what advancements do you predict for the future?
So if I gaze into my crystal ball, looking maybe 15 years from now, 15 to 20 years from now, I would anticipate cataract surgery will be looking very, very different to how it looks today. We will have a surgeon who will be supervising a process through multiple operating theaters where patients come in, and the laser, or should I say the robotic laser system, is able to perform the vast majority, if not all, the entirety of a procedure within literally about 2 to 3 minutes. So surgical times, if you think, have over the years have got shorter and shorter. Cataract surgery now can be anything between 10 to 20 minutes or so for the average surgeon. This is now dropping right down with robotic and laser treatments to maybe 2 to 3 minutes. So patients will be having procedures done very quickly, very safely, and surgical centers will all become kind of centralized. So you have very high volumes of patients coming through and having these treatments done. I think there will be additional improvements in devices for certain patients who may not be candidates for robotic surgery, such as smart devices, which, for example, limit your movement based upon what you're trying to do. A bit like your car steering wheel gives you some resistance as you try and cross a lane in a motorway. That technology is there now. We'll have those sorts of things in surgical devices to allow you to add another layer of safety as we are actually going ahead and performing surgery. In addition, I mentioned the sort of what's going to sort of happen with technology in devices is that you'll have smart devices. Intraocular lenses will be changed to sort of, as I say, spontaneously adjust to the position that you're looking at. And we will have computers in contact lenses that will allow us to focus on things. And as I say, link into our World Wide Web. So we're able to sort of almost work and communicate and interact with people from around the world in real time as we are simultaneously doing something in the physical world.
Fantastic, Mr. Trikha. A really, really interesting insight for sure. And our last question then for you today. In terms of popularity, is eye surgery more of a sought after operation now compared to previous years?
I would say that as safety levels have driven up higher, I would agree with you and say actually it is more sought after. And there are a multitude of options now available to us that we historically didn't have. Increasingly, if you look at other countries like the United States, for example, laser eye surgery is viewed amongst certain demographics, younger patients, as being much more kind of an option as opposed to having to continue to get contact lenses and glasses. So that's certainly one area. And as I say, with glaucoma now, there are more procedures, minor procedures that are available, such as minimally invasive glaucoma devices that allow us to control glaucoma much, much better without the need of using lots and lots of eye drops with lots of side effects potentially. So I do think that surgery will be increasingly popular, just mainly because it'll be driven more by safety, ease, and recovery times will be much shorter. The final thing to just add to that is as we talked about earlier with the surgery with using robots, we think about our fleet of electric vehicles at the moment, such as our Tesla cars. The Tesla system works, by the way, if one Tesla has an issue or has a crash or an experience, that information is fed back to the entire fleet. So the entire fleet of Teslas get better and better. And if we think about that in the way of where robotic platforms will go, it'll be much the same. So the entire fleet of robotic eye surgeons will get better and better based upon machine learning and artificial intelligence. So I think this is a really, really exciting time. I think the way that eye care will be delivered over the next 10 to 20 years will be very different, and the pace is, changes is accelerating. So overall, I do think that it's a great time to look out for these new technologies and have your eyes looked at if you need to.
Fantastic, Mr. Sameer Trikha. Really, really insightful insight into the technological advancements in eye care and laser eye surgery. Really fascinating. And for any viewer or listener who is really intrigued about this or sees themselves as ideal candidates for potential laser eye surgery, you can head on over and check more information out on Mr. Trikha's Top Doctors profile via www.topdoctors.co.uk. For now, Mr. Trikha, thank you very, very much for that insight.
My pleasure. Nice speaking with you.
Bye, Mr. Trikha.